Today, we are trying to do this free webinar to educate you on how things that and what things that you need to know and what regulations you need to know and you need to be aware about so that you can have a better understanding about a non-medical home care agency setup. I'm trying to get you some understanding about what's non-medical services, and how this home service agencies differs from the rest of the agency or the program types, and important details that you need to know about the regulations from the state of Illinois. So this is your application. This is your entire application for home services. So this is how the regulation looks like, and you should understand before you begin things. All right, I think guys, we can get things started today. So today's session, we are trying to do a complete webinar on how you can license your agency for a non-medical home care service in Illinois, right? So if you're trying to think of trying to set up a home care agency or as a non-skilled or non-medical services within the state of Illinois, so we'll be trying to take you through the entire process and what things you need to know and how you need to do the licensing process or the paperwork, the applications, and prepare your policies and procedures. So we are going to take you through everything today during this entire session. So we have planned everything out to give you all the details on how you can do it on your own. Righty. So just a little bit of introduction to myself. So my name is Anton Fonseca. So I'm a CHC and a CHAPA accredited consultant, and I've been working in this industry since more than 7+ years of experience in licensing and credentialing. So since 2019, we have started Care Policy and providing the support services for new providers like you who are trying to set their businesses in the senior care or child care industry, and who are trying to get a new business start with this the senior care, the home care services, home health, group home, the mental health services, community living arrangements. So we will be supporting these new providers to get through the paperwork, the licensing, and also we provide the other services, the support services like IT services to get your websites up and running, the marketing services, and also we provide the branding and all the design services. So pretty much everything that a new home care provider should need support with, so CarePulse will be providing for you. So today we are trying to do this free webinar to educate you on how things that and what things that you need to know and what regulations you need to know and you need to be aware about so that you can have a better understanding about a non-medical home care agency setup, and also on how to get your approvals to start your new business within the state. So, righty, let's move forward. So we have clearly a well-planned session today. As I mentioned, we are trying to take you from A to Z. I'm trying to get you some understanding about what's non-medical services and how this home service agencies differs from the rest of the agency or the program types, and important details that you need to know about the regulations from the state of Illinois, and how the fee structure, the timelines for the licensing approach, everything we'll be discussing during today's session. So you can feel free to ask the questions if you think that is something that you need to know at the same time. However, we have a Q&A sessions at the end as well, but if you have any questions, you can feel free to let me know and we can make this an interactive session. So to educate everyone who are trying to get their new business set up within the state of Illinois, right? So let's move forward. So as I mentioned, Care Policy is a well-reputed company across the country because we are providing all 50 state support services for licensing, accreditations, credentialing, and the policy procedures, and also the additional support services for operational support for home care agencies to get into their business. We are getting a lot of support. We are providing a lot of support, especially for seasoned professionals in this industry, healthcare industry, RNs, doctors, and veterans, and CNAs, LPNs, everybody trying to get our services. And we are a very proud provider of this consultation to these communities to get their new business set up with the highest quality and with assurance to get everything set up and running the businesses in the particular regions and the particular states. Right. So going ahead with the objectives. So today's session we are trying to cover pretty much what you need to know about the quality care, the rules and regulations, because every state, I'm sure you know that every state has its own state specific regulations, right? So you need to be aware that since every state has its own regulations, own administrative codes, and own way to process things, we have to stick to the particular states, the regulations and the guidelines from the administrative codes that is listed in the law codes. So that is what you would see, like the chapter sections under the administrative codes from the state. And the other thing that you should know, um, the state has its regulation, but there are multiple programs, right? In Illinois, there are a lot of programs for senior care providers or child care providers. You have this home services agency for non-medical home care agency. And then you have something called home health agency for skilled services. And then they have another program called home nursing services for nursing related services. And let's say if you're thinking about a group home, there's a very popular program called SILA, Community Integrated Living Arrangement. So likewise, every program also comes with a different regulatory code with a different way to handle the paperwork, the application process, and it has its own way of preparing the documents, which means it has separate and dedicated regulation that we must follow when you try to get you through the process. So that's why I mentioned the number one, the state specific regulations, and the number two, the program specific regulation, and the number three as a service specific regulation. Even though under the same the program, based on the type of services that you wish to provide, the regulations and the ways of doing things change in terms of the paperwork and getting you the approvals. So that's something you should keep in mind wherever the state that you're trying to get things started. You should first of all, your question should be, what services am I going to provide to my community, and who's going to be my targeted customers or intended audience. So based on the services that you select, then you have an idea, okay, these are the services I'm going to provide. More of personal support services, companion sitting, meal preparation. Then you think which program is going to be the most applicable one for you, whether the home nursing, home health, or just a non-medical home care agency would meet my requirements. So that's how you select the program within the state. And then, of course, since you're living in the state of Illinois, your choice would be the state of Illinois regulations automatically applies for you. But if you're someone who's trying to think about the options like the state, multiple states, some people think Virginia, Georgia, Texas, California, or Illinois. So, you have a lot to compare. You have a lot to think. If you're someone like that, then you would need to first of all go through the same process that I mentioned, the service level, the program level, the state level. So that those are the regulations that's going to be varying on your case. But one more thing I'll commonly share with you, if it's something like a group home or community living arrangement, a facility, a treatment center, or assisted living facility, then there's additional rules comes into effect called regional or the county level rules. Because of your property, you need to go through the zoning verification and the certificate of occupancy. There are a few things that you need to worry when you think about a group home business. And that's also regional regulation applies, but only for group home related setup of the business that is going to be valid, right? So, and also today's session, we are trying to give you about the full licensing process and how you can avoid any mistakes and be on track. And you can't afford to have any mistakes. That's the first thing you should keep in mind. No mistakes are allowed, so we have to try our best to keep the minimize all the errors and be on top of the game in the compliances, because we are not trying to do something creative. There's nothing there's nothing nice things we can do on this application process. It's a matter of 100% compliance. It's a matter of meeting all these requirements and making everything perfect and no mistakes and exactly as how the state wants you to submit, you have to submit all the documentation and the paperwork. So that's something you should keep in mind. So no mistakes are allowed and everything should be perfect when we try to submit to minimize all the errors and the delays in the timelines. All right, and the policies and procedures is something, a key document and a key component in the entire application process and the package. And one more thing that you need to worry, the policy procedures, I wouldn't say a worry because I would say something that you should be aware of. Policies and procedures are just the one key component of this entire package, because we used to get into calls with every day with new providers, but they just think licensing mean you submit the application and the policy procedures is the two documents. It's never going to be the case, because the policy procedure is mandatory in every case, but it's just a one key component of the entire application packet. So we have to consider the rest of the support documents, the legal documents, and everything combined. We call the application package or application packet that's ready to submit. So keep in mind, guys, policy procedure should be efficient and meet compliances and reference all the administrative codes wherever it's needed and necessary. But the rest of the documents also should comply to the required legislations and the regulations. So at the end of the session, we are planning to take you through a real life example of and a Q&A session to discuss all your questions and try to take you through actual case study that we have licensed. The recent client's case study we are trying to take you through on how we license, the paperwork, how we did for them, and how we prepare the checklist and how we organize everything, and how the submission and how the approval came. So that's the whole plan of this entire the webinar. So stay in touch, and the end of this session, you should be learning on how to license things on your own. Even you don't need a consultant like us. We are trying to give this for this entire the learnings about the years of experience, and we are trying to share it with all the new providers to understand things on your end and do things on your end, so you can submit everything on your own. So that's the real objective of this session. All right, so now the question, what's and how would you define home services agency, which is a non-medical services? So this is pretty much that you can provide under home services daily living activities, but it do not require medical care. And these are services like personal care, companion sitting, meal preparation, light housekeeping, and transportation, helping clients remain independent and comfortable at their own homes, and providing skilled nursing or medical treatment is part of the home services. That's why we say without providing skilled or nursing services, because to provide the skilled and nursing services in Illinois, there are two other separate programs. Separately, you should license those things. It won't come under the same home services agency. And one more confusion for those who are from out of the state, if you're watching these, if you're live here or watching this later at in portal, you might get confused. What does this home services agency means? Because this term is used only in Illinois. You don't see home services agency terminology in any of the other states, because the state of Virginia, for the same non-medical home care, they use home care organization. Georgia, they use private home care provider. And in Texas, they use personal assistance services. In Indiana, they use the PSA, that's a personal services agency. So in Illinois, likewise, they use the term home services agency. This is what you can consider as a non-medical home care service program. Okay, and you can provide all non-medical services, but not skilled services under a home services agency. All right, now the question, why you should start a home service business in Illinois or a non-medical home care agency in Illinois? So this is a question most of the providers they try to understand, because this kind of a business is highly lucrative. The reason why I'm telling you this, the senior care is never done every day because of the aging population. You know, the demand for the senior care consultant, the senior care, the providers and the caregivers, there's a huge demand. This is never done. So if you see the numbers over here, the total aging population within the state of Illinois, for 60 plus, it's around 2.9 million. 2.9 million of the total population over 60 plus. And out of that, population served by a licensed home care provider, it's less than 100,000. It's around 60,000, 58 to 100. So imagine the gap. There are so much of people who are in need of services, or caregivers, the licensed home care providers, but there's a huge gap or a shortage of these licensed providers to cater to this demand, because everyone after 60 plus would require senior care support, would require non-medical services. So this is a business with high demand, growing market, diverse community, and you should definitely think about getting into this market, because this is easy to access and easy to start. And I don't see at any cost, you have any chances on making losses, because the cost and the capital is very much minimized. So it's a matter of you getting the license, because license is the only barrier for new entrants to, get into the market. So once you secure a license, which means you have a real asset, that investment is going to create you a huge asset that nobody else could have, because license is the only asset that you can, secure your business and making sure you are going to get a lucrative business up and running. And under a growing market, high demand, and a lot of customers around, and there's a already huge gap. So it's a matter of you getting the license and getting into the business. Because I'll try to tell you something, because of my experience. As I mentioned, every day we have around 10-15 calls with our customers, uh, and we see a lot of customers, around 50% of the customers, they're not from the industry. I know for most of you guys here on the call, could be from the healthcare or the senior care background, but some of the people from the different states are also trying to think about this, the market, the real estate, IT, and the fashion industry. We are getting a lot of customers from different industry who are trying to think of getting into this business because of the demand and the growing market. So if you're in this decision with comparatively the rest of the states, so this is something that you should definitely think about on getting your business started as soon as possible, because this is a highly profitable business that you can get started. Righty, so now the question is, what cities? Now, I'm sure that everybody is having some understanding about what cities that you should license and what cities would be more helpful for you to get things started, right? So as you can see, there are several cities that are a little bit saturated already. And also there are cities that are, you have still a lot of potential on getting things started. But I'm trying to tell you, even this is the chart, it's comparatively among the cities. This is how it looks like, the county wise, but still there's a huge gap. I showed you the gap that is existing. Even though you try to start on a saturated market or a city, it doesn't affect you much. But as long as you can, come to a city where there's less competition but high demand, then that's the best place that you can get this started. Actually, we have a blog article written, just if you're in this decision, you can go through this. I can show that to you. So I think our team will put this on chat as well. This is the best city. So if you want to go through our resources, you can subscribe to us, and you would get all the updated articles. And we have a blog section where we update everything about all this information. So these are the best cities and the counties you can select for the next year for establishment, and you would see what areas with high competition and the market inside it is crowded. and how you can succeed. We have given all the tips and tricks on getting you establish your business. Right, so this is something you can go through this article and try to understand or learn about the cities where you want to get started with your business. All right, so the question is, we have a comparison between the home services, home nursing, and home health agency. Now the question is, what's the difference between the home services, home service agency, and the home health agency? So, as I mentioned, these are three different applications, three different processes, and three different ways how you need to handle. But one thing I'll tell you, previously, like I think 2023, they had all these services under one application, but now it's changed. So you need to know now home services mean non-medical, home nursing mean is more of the nursing services, where you would set up the wound care, medication setup, nursing treatments. And when we talk about home health, that's more about the therapies, the physical, OT, and PT, and the home health aid services is what you can provide under a home health agency. Right, so the Medicare is not allowed in non-medical services, which means the home services agency, but the Medicare you can license for with home services, I mean home nursing or home health agency with CMS. Right, so this is the licensing department is the same as the IDPH for all these three programs, and this is what I mentioned. As I mentioned, the nursing care and the patient recovering from illness or surgery, the home health works. And one more thing, the setup of this business, it's going to be a home setup, which means you are getting the license and sending out caregivers directly to their own homes and providing the services for home services, home nursing, and home health. And you don't provide anything under your facility or inside your home or inside your building. No, you don't do that. You only own office space and you send out caregivers or HHAs and RNs to provide the caregiving inside your client's own home and come back to your office. You don't stay there overnight, or you don't keep the resident inside your building. No, you don't do that. The setup of this the services happen inside your client's own home, and you provide the caregiving and coming back out of their own homes. Right, so that's how the services, the nature and the setup of this business. So this is what I mentioned about the what they have updated. So as I mentioned previously, let me try to zoom this a little bit. So previously it was in 2022, we had everything in the same application. You'd see right here, home health, home services, home nursing, all the licensure comes under the same application, but different sections, even though it's the same application, different sections. But now you have three different application documents to be submitted for the three different purposes of home services or home health or home nursing, right? So this is the latest application process. And one more thing you should know, unlike the other states, this state has all the application, it's going to be full manual process, which means it's a printed documents. We have to prepare the package and the binder and mailed to the state Illinois Department of Public Health, and then they would revert to you with the results of your license approvals. So you will not be submitting any online application. It's going to be full manual application process to work with the home services application or home nursing or home health, whichever the one you would like to proceed. Right, so three things you need to understand. So, okay, so far, do you have any questions? Let me know if you have any questions, so I'll try to get you through the process. Do you have any questions that you wish to clarify before we proceed to the next sections?
Not at this time.
All righty, awesome. Okay, so there are three things that you need to understand. Three things, the most important things, the regulation itself. I'll try to pressure you from this point onward about the regulation and the administrative codes because you can skip that. You have to be up to date about the latest changes and the changes that comes into effect from the regulation itself. So these regulations are something you have to be very carefully handled. Make sure every code or every chapter of the section which is specified in the regulatory requirement we must meet. No excuses. We can't afford to miss any of the regulations. So it must meet all these guidelines. So that's why I said we can do any nice things, we can do any creative stuff, but it's a matter of meeting all the compliances and sticking into the framework of the legal legislations, right? And also, you will need funds for the insurance and office setup and employee background screening. It's something that you need to think about. But this is not going to be a greater cost compared to Group Home or Mozilla because this is just a home care agency. As long as you have an office space, even it's a home office, that's something you can start and get yourself the license. So some people, I think like Latries is working already on Silla license. So it's something, you can definitely think about this home nursing, I mean the home services agency for non-medical, because you have already a home office or office space within the state and you have all the legal documents. So it's a matter of getting the license and having that as an additional business set up for your organization. So these are the things that you need to think about. And of course, you need to have the articles of organization, but it can also be articles of incorporation as well. So I'll try to break this down. Articles of organization, which is where you get a limited liability company. It's a LLC. The articles of organization is suitable for some organization with single member ownership, dual member or the partnership ownership, like or else around let's say 2 or 4 owners who are combined to get this started, then LLC would be more than sufficient. But let's say if you're trying to think of a very large scale business or into expansion into Nasdaq or stock exchanges, then I would say incorporation would works for you, but it's up to you. Even though you have few members, you can still go with incorporation. That is where you would get the INC at the end of your business name registrations. Whichever one it works, and it's up to you to decide which is the most suitable, the legal structure based on your case. It's going to be case by case changing. So it's up to you to decide that. And also the EIN, that is the employee identification number, that's a tax number. So that's something you definitely need to have regardless of whatever the business you run. That's for the tax purposes. And right, so these are registered with the Illinois Secretary of State for articles of organization or articles of incorporation, but the EIN, it is a registration with the IRS. All right, so this is the, we'll go through the step-by-step licensing process. So this session, I'm going to take you on understanding about how you can license your home service agency. So as I mentioned, the regulation for non-medical home care services. So let me show you the regulation. So this is what we are talking about: Home Health, Home Services, and Home Nursing Act. And these are the legislations and the code you need to worry about. And this is how the regulation itself looks like. If you're someone who's trying to start this newly, then I would recommend you to run through this, just read these regulations. And this is where every guideline is provided for you in detail. Sometimes it might be confusing to understand, but still you should have a better understanding about what the legislation or the regulation says for your business type, right? So this is how the regulation looks like. and you should understand before you begin things. And then fill out all the required forms and the documentation. So the form application number is 445104. So this is the form that is what applicable for you to start your the documentation. So this is what we are talking about, right? So this is your application. This is your entire application for home services. And this is issued by the state of Illinois, the Illinois Department of Public Health. And this is where you need to submit your application packet. And you have to pay a 1,500 licensing fee. That's annual fee. Every year you should renew. And so they have given all the instructions and how it should be done. And this is going to be your initial application because you're not licensed yet. But if you're a licensed provider, you can consider the renewal or change of ownership. There are a lot of things that you can fill out on this application. So, and also the counties that you plan to provide or the branches, so everything should be filled inside this application. And as I mentioned, this is a full manual application and you should mark everything that's applicable for you. So you're going to be more of a proprietary, that's going to be for-profit business, the ownership. So you have to mark everything and make sure to list every the shareholder. And how you know how many shareholders? They are the partners. When you register your legal business or the legal structure, you know, like you had two partners with 50% ownership under your LLC. And both of you should be listed, must be listed, and the percentage of shares should be presented to the state. So, and we have to provide all this information, and this is a very detailed application process. So you have to fill out all these information and the geographical areas that you wish to provide the services. Right? Righty, okay. So this is how the application looks like. And one more important thing. Okay, this is something you should definitely know. You can't have only you to start this business. But I'm not telling the owners, you can be your owner, single member owner, but you should have two personals called president and the secretary listed in the application. Let's say if you're a single member owner of the business, but still you need to have someone as a secretary information to process the application. You alone cannot process the application, but what you can do is if you don't have two partners or two owners, you can be the 100% owner, but still have as an employee, if not have someone from your family or colleagues or someone as a secretary listed in the application for the documentation purposes. And the secretary also would require to go background checks, fingerprinted, and they also should provide the informations like their date of birth, the SSA, and driver's license also. So, but what I'm trying to tell you, two persons are required, president and secretary. And if you have two partners, then you can just allocate between two partners who is going to be the president and secretary just for the paperwork. There's no big deal in that. But actually, when you try to, get through the operations, you can decide who you want to have operate the secretary, whichever works for you. Um, but you should have two people listed in the application and the president and the secretary, and not both of them should be owners. One can be the owner and one can be an employee or a friend or a family. All right, so fill out all required forms and documents. So there are a lot of forms that is supposed to be filled during this application process, called the copy of the current contract and the copy of the scope of services and the copy of the agency's fee schedule and job descriptions. We have to provide the general liability insurance coverages, the compliant resolution policy procedures we have to prepare. So all these documentations are supposed to be prepared and presented as part of the application package. Okay. So all these are required items and we have no chance of missing any of these items. Every document is listed here, should be presented as part of the application package. So I'll try to show you something. So this is the proposed amendments that recently we got. This is applicable for home services, the client contract services, and home nursing and home service agency. So there are some guidelines that you can read on this documentation about what's applicable and how you should have the documents prepared for you. So this is the guideline document for you to verify and understand exactly what you should be doing and how you should be doing. All right. So that's the documentation part of it. But everything, every item should be available in your package. So that's the understandable thing that you should keep in mind. So, all right, so proof of access to IDPH healthcare worker registry. So this is something the state of Indiana, the Department of Public Health would require you because of the background checks and the fingerprinting. They have something on a web portal. We have to register the owners and the agency under this user registration confirmation. So the IDPH has its own web portal as well, but it's not for the application processing, but this is mainly for the background checks and the information initial access processing, right? So this is also a process that is part of your requirements to get and register inside this portal. All right. And this is the proof of access. You should be inside the healthcare worker registry. All right. So now what you need to understand how you're going to prepare the documents efficiently, right? So this documentation that I mentioned to you, policy procedures, the care plans, job descriptions, any forms, the background check forms, the documents, every supporting document we create should be in compliance to the regulation and the guidelines that they have provided. We can't skip anything. Every document, like policy procedures, usually most of the states they expect you to have it referenced right on the top, but it depends on the state to state. But it's best to have things referenced and mention the codes wherever it's needed, and that's a justification and a clarification to the state reviewer that you are in compliant. That's easy for them to do. Okay, these guys have mentioned all the code reference in every document they have submitted, which means I don't want to go through the entire document. I can simply approve. But if you haven't mentioned any of the administrative codes and the relevant codes in the document, they would suspect. They would have a question. Are these documents general templates they're just submitting us, or are they state specific or the program specific? So if they have this question, the doubt, that's going to be a problem. They are going to dig into everything in detail and mark what is missing, what's not available, what are the errors. So from the first impression itself, we have to make sure whatever the sets of documents we prepare should look proper, and also should definitely meet the compliances and should have the sense of compliances when we submit everything to the state by mentioning, by including the numbers, the chapter code, administrative codes, everything should be mentioned throughout all the documents. And it should also be organized in a way how it needs to be submitted. So you can miss anything, like you have to organize the package. So those things will guide you in the next slides, how you have to organize, how you need to prepare, and how you need to print out and send to the state. We will guide you in the upcoming slides. All right. So you should label every document clearly, as I mentioned. Every document should have its own name, and we should never staple or bind any papers because this is specifically mentioned in the state guideline. They're not going to accept binders for like the other state. For the state of Illinois, you can do a binding. So they should be able to have everything printed on the same set, and it should not be stapled, but you have to organize everything one at a time and submit to them as a whole set of documents. It is going to be easier for them to, cross check, because it's a manual review. This is no automatic review. They're going to manually go through the document by document and tell that it's correct, it's wrong, here's a deficiency, this is wrong, and these services you mentioned under home services, you have mentioned some skill services, you have to remove this. So it's easier for them to figure out these deficiencies and send it to your way, right? So, and make a full copy of the application for your record. It will not be returned to you. So this is something the state, we would recommend for all of our providers. When you submit application package, but for the people who works with us, you always retain a copy for of our every client, because just as a safety. But when you submit the original copy, the printed version, always make sure you retain a copy, a photocopy of your the submitted documents, and when you submit to the state, right? So that's something you should definitely think about. And also, there is application fee of 1,500. The state will review for deficiencies, and if there are deficiencies notified, they would send to you. But the good news about this, the state of Illinois, they they're not going to reject in most of the cases unless it's a very huge mistakes and inconsistencies and careless work. They will reject right away. But if they see minor errors, just one or two simple errors, then they would send you a deficiency report. So that's how they're going to work with you, and they would be emailing you everything. So you have to be very careful to be attentive to all the emails after you submit the application package, right? So the other thing, as I mentioned, the email address that you provide in the application should be the active email, a working email, because that's where all the correspondence comes. And the other thing you should definitely keep in mind, when you submit application, you can expect anything in the first few weeks. No, these guys are not going to come back in the first few weeks. We have to give some time for the state to process, because that's practically they're taking a few months to prepare and get back to you. So until then, now you don't know, you submitted the application package, but you have no clue when they're going to come back and trying to tell you whether it's approved, whether there are deficiencies. You don't know. So you have to be doing some work from your email, at least twice a day, once a week, or just double check the email, check your promotion tab, spam tab, everything, to make sure whether you have received an email or not. But you can start doing that after the first month's time, because that's generally is when they would come back to you. But let's say if you miss an email, important email from them, that's going to be a nightmare. It's going to be very hectic for you to recover. You miss the email, and the email, you know what they have mentioned, if it is not approved, they would, the option, or the possibility is a deficiency. And when they say there's a deficiency, they're going to tell you, hey Ziva, there is a deficiency for this particular area. These, the job descriptions that you submitted are not in line with the regulation, or the job description doesn't provide the real services a non-medical, or let's say a home care provider is providing, or the RN job description is invalid or not correct. So, and please correct this and send back to us within 10 business days. So you should definitely be able to provide those fixes and send it to the state within those 10 business days. Imagine you missed this email, you never know they came back to you, and you were seeing this on the 11th day or 12th day, and that's a rejection. That's a denial of your application. They're not going to be easy on you, even though you request that you would say a lot of reasons. Practically, as humans, we have a lot of reasons, but it is not applicable for the state's end. We have given you 10 days, and it's your responsibility to keep your emails active and respond back to us within the timeline. So we shouldn't go into that level of nightmare. So make sure everything is perfectly handled and smoothly handled from the first time itself. But in case even a deficiency comes, you should be ready to check your emails and make sure everything is good to go. Okay. All right. So, and the other thing, guys, if you get rejected, I'm not telling you would get rejected, but if you get rejected, don't go to work on something that thinking you would get rejected, because every time you submit a new application, it's going to be 1,500 application fee that's non-refundable. So you get rejected for 10 times, it's going to be $15,000. You have to still keep paying them just to submit your application. Unlike we discussed about yesterday in the webinar for RSC in Maryland, you are not required to submit the application fee at the beginning of the submission. It's a free. But once your license is issued, only you have to pay around $1,000 to the state. That's very fair. But in Illinois, you have to pay 1,500 right up front, and if you were rejected, you had to repay. If you're rejected, you had to repay. That's how the process works. So from the first time itself, you should definitely work towards getting you the license, and no errors, no mistakes, 100% in compliance. All right, so as I've explained, this is the fee structure and this is the expected timeline. So we have seen some positive thing over here in Home Services Agency. The state would never tell you a timeline when they would get back to you, but with our past experience working in this industry more than 7-8 years, what I can tell you, a home service agency could be licensed under 2 to 3 months time. Average, because this is what we have seen for most of our past clients, we were able to get everything perfect and get you through the license in 2 to 3 months. But some time it could be delayed or it could be faster. It depends on the volume of application and the person who looks at or review your documentation. But this is the average 2 to 3 months is what you can expect. All right, so these mistakes you should definitely avoid. The applications should be filled out completely and correctly, no mistakes. And you should have all the background checks passed and all the documents, the insurance, the LLC, every item that is needed for you to submit must be there in your package. Don't miss a single document. That's going to be a big headache for you. And ownership documents, business registration, and respond promptly to any additional information request. All right, so what happens after you have the license? You can begin the services and provide the services. And how can you continue to keep your agency compliant? You have to be up to date about the compliances and any regulatory changes after you get the license. So this is after the full license. Right, so do you have any question, guys?
I have a question. This is Latrice. I submitted my information and everything for my my application. That's already been done. But for my senior care home, that's completely different than this here. Would that be different, or is that the same for senior residential care?
Yeah, so are you referring to a group home or are you referring to the home services agency?
Assisted living.
Yes, it's completely different, Latrice, because what happens, as I mentioned, every program is governed by, even though it's within the same state, it's being handled by different sets of departments, the governmental departments, right? Because the CELA, it's handled under the IDPH as well as the BALC, that's the Bureau of Accreditation. So they have a different team to handle and a different process. It's very different. The CELA is what you already went through and got through. But when we talk about assisted living facilities, they have a different sets of regulations and different process. Likewise, home services, home health, home nursing, everything is different because it has a different regulatory code that we need to comply. Yeah, that's something, I understand that because that complexity is there not only in the state of Illinois, but every other state. This is the same problem. There is no consistency in the documentation of the process when you try to do something, even though it's a very, very similar program.
So I'll hold the rest of my questions for the end. Okay, thank you.
All right, okay. All right, guys, let's try to walk you through a real life example on how we will be taking you through the process if you have to work with us. As consultant, the first thing, once you say that these are the services that you would wish to provide, and these are the program that you wish to go with. So we would be taking you through this the in-depth understanding. For the first thing we do is to go through the regulation itself and try to understand what's the most applicable the regulations. And based on that, we'll be coming up with a detailed checklist to make sure that we don't miss anything. So that's the first way, the first thing that we do that. So for home services, the first thing we do that is to prepare a detailed checklist like that. And for example, there are nearly, let's say, 25 documents average to complete in order to get you the license. So I would say exactly it's around 26 with this blank left over. Yeah, it's around 26 documents. So we should have the liability coverage, your LLC, EIN, sample client contract. So these kinds of all these documentations we should ready in order to get you through the licensing. And also we'll be collecting all the information for the application to process the agent's information, the your applicant information. So in home care services, it's going to be the president and the secretary information. So everything they have to collect in order for us to get through the application. So if you have to do this on your own, make sure you list everything, every item, no mistakes, nothing is missed. So once before you can submit the application package, once every item is ticked off, is when you are comfortable to submit the application, right? So that's why a checklist is very important and very much needed to get everything done. So the other thing is that once the checklist is ticked off and every supporting documents, we prepare a Google Drive to upload all the documents. So it looks like this. And I think I can show you some sample documents on how we prepare the documents. So all these items, all these documents are needed to complete your license. So this is how you should have these documents ready. For example, the client records management and release requirement policy. This is how it should look like. And this is what I mentioned as the codes, the policy code. Whenever the state officer sees the review or the analyst sees these codes, they know, all right, these guys are in full compliance. They have specified the policy code, so I don't need to worry about going word by word. That's the level of comfort that we give for the state analyst, because they're not going to run around your application and waste their time. As long as they see these codes, we have reference for each of the requirements, then that's a simple pass for you. So I'm trying to give you some understanding how they should be prepared and how they should be submitted to the state. So these numbers are based on the industry average. So you can get an understanding how your document should and what it should consist. Alrighty. Okay, what else? So these are the individual service plans. Yeah, these rates and the frequency. I showed you this inspection control and the job descriptions. Yeah, so this is how your documents look like, guys. And make sure, again, what you need to really worry about, that's the compliances, and make sure everything is correct when you submit to the state. And you should have the detailed policies and procedures prepared. And this is a comprehensive document. This should consist all these requirements and the items highlighted in your policy procedures. Alrighty, so this is something, if you need these documents, we have it's readily available to download for you. And these documentations are already pre-made by the care policy consultants and RN consultants, and is readily available to download. Right at the end of the session, I'll tell you how you can get them for you. So the rest of the things, you can fill out the application if you need and submit all the documentation from us, or else if you need the consultation itself with care policy support, we can do that for you also. So, right, and the creation of documents, again, the regulation, the compliances, and always try to avoid any revisions and the rejection from the first time itself. Try to make sure everything is completed. That there are chances that the state would still come back to you and asking you to do some revision deficiencies. In some cases, is unavoidable, regardless how compliant we are. So, but still, you can minimize everything to save your time. So we have three review processes. Let's say the package. Now we call a package is ready when three things are, met. The first thing, that's the legal documents. That has to come from your side, because it will be your responsibility to get the LLC, EIN, insurance, the background check, so those kinds of few things. But if you don't know how to do that, the consultants of the care policy will be guiding you through every step of the way and giving you instructions and informations on how you can get things done. So once the legal documents are ready, and then the support documentation. So the written supporting documentations will be handled from the care policies and your policy procedure, job descriptions, every other document. We know exactly what documents need to be submitted, because we have submitted for a lot of customers and we have got them approved at the shortest possible time with our expertise, and the documentation, support documentation from our side. So legal documents from your side, the support documents from our side, and the third step, the application, also is something that we handle for you under our consultation or the full consultation package. So the entire application we fill out for your requirements and ready the package. So once the package is ready, the application, legal documents, and the support documents, everything is good to go. So this is where we do three review processes. So we, first of all, our document specialists go through all the documentation and making sure everything is good to go in 100% compliance. Secondly, it will be your responsibility as the client of ours. You have to make sure every information you submitted for us are accurate and complete. No mistakes are allowed. Trust me, if a mistake can cost you months and months delays and cost and time, everything. So the third step, it's going to be the consultant review. So it will be Marcel or the rest of the consultants at care policy will review and go through all the documents and give you the final confirmation. Hey, Zivaho, hey, Latres, you can submit your documentation pack to the state, and we give you with the detailed document on the instruction, how to submit, how to print, what is the order of printing, and how to prepare your documentation set, and how to attach your check code, the money owed on top of that. So, and how you can safely submit to the state. So that's how we provide the services and making sure everything is good to go. And we usually take 21 business days to prepare everything and ready the application, all the documentation. And while this 21 business days, you can work on your own and provide us these required legal documents for us. So, and then hopefully the plan from our end you would be to submit everything in the 22nd day, but without any delays, we are trying to fast track things and make sure everything is good to go and everything is ready before we submit. All right. So the other level of support that we provide, that's the, as I mentioned, the other level of support, the ongoing compliance support. Let's say after you submit to the state, there are chances that the state can come back. So then there has to be some kind of a support and a guarantee from the consultant that you'll be working with is us or somebody else to protect you and look after for every support changes or every state changes or requirements to be with you until you're fully approved. So that's the level of commitment that we provide. Until you're fully approved, we will be working with you. So that's how we take you through the entire process and making sure that you get the full approvals. Because one thing that you need to know in the Illinois Home Services, once the paperwork is approved, you get something called provisional license, right? The provisional license is valid only for 240 days. Okay, the provisional license is valid only for 240 days. After this, you should have the inspections ready, and they would come for inspection surveys. And once you pass the inspection, then you would get the full license. That's where you get the full license after the inspection surveys. But within this 240 days, the inspection survey should happen, and so that your provisional license, before the provisional license get expired, you would get the full license. All right, so this is the license receiving part. As I mentioned, the provisional license you get, and then the full license after the inspection service. So once your home care license, this is what I'm telling you, additional process or additional step. This is not required for your licensing journey, but this is required after your licensing journey is done. After your home care license, then you can think about becoming a Medicaid provider enrollment. Uh, Go through the enrollment process and become a Medicaid provider. This is where you can license. I mean, this is where you can attract Medicaid funded clients, which is also another revenue source for you. This is something, because what happens when you try to have the home care license, initially you're becoming open and attracted to the home services. I mean, I'm sorry, the private pay or the private insurance, right? Because you would get the customers on your own, the referrals, the family, friends would send you the customers. But when you have the Medicaid provider approval, that's going to open doors for you to attract the government funded clients, because you are a Medicaid approved provider and the you have the accessibility or the eligibility to accept the customers who don't want to pay out of their private pocket but to pay through the Medicaid. Since you are an approved provider, you can help them out through get through this process. Okay, so this is something you should definitely think about, getting through the Medicaid process after you get your home care license. All right, so this is some kind of enrollment process for Medicare, but Medicare, I need to be very clear. Medicare is only for skilled, which means it's only going to be valid for home health and home nursing, but not for home services, which is non-medical, right? As I mentioned, Medicare comes only for skilled services, and we have to register for Medicare with CMS 855A application. So we have to be careful on how we are going to submit the application, and we have to apply after you are initially licensed for Medicare and Medicaid. But Medicare, you can apply for home services, but if you're providing skill services, you can apply for Medicare. All right, guys. So, okay, I want to tell you our solutions for you. If any of you are interested to proceed with our services, we have the full consultation package services. Everything we cover for $29.90. This is for the full consultation, licensing, application support, all the policy procedures, all of the documentations, everything is provided for the price of $29.90, and take care of you until you're fully approved. I think we're offering a very, very affordable price compared to the other market prices out there. So this is for everything that we are providing. But if you are someone who is thinking about, I can do the application myself and I can go through the regulation myself, and I just only need this set of documentation, just on that, just the documents and the policy procedures, then you can simply go ahead and get this $990 package. It's a licensing complete licensure package, and it's available for instant download. It's right, you pay, you get the entire downloadable documents pack ready to download, and you just need to insert your agency name and submit to the state. That's it. And if you need only the policies and procedures, the detailed policy manual, it's going to cost you only $199. Right, so these are the packages we have, and these are the offer prices. So you can go ahead and purchase on our website this if this is something that you're looking for. So this is where you can find, this is our care policy website, and you can go to our services and go to license and consultation, and you would see the end-to-end consultation services. Everything that I explained from consultation to requirement regulation analysis to document assistance, application filling, submission instructions, and the license guaranteed as long as your backgrounds are clean and as long as you provide all complete and accurate information, not just for you, the background has to be clean for every person we mention in the application. So those are the few consideration uh, that we need to consider. But the rest of the things pretty much handled from our end, so you don't have to worry about the application approvals because we take care for you on that aspects. So this is where you need to go and place the order and confirm the services. And once you place the order, you have a requirement form to fill and confirm what services. You can say home service agency and tell us the state as Illinois, and then submit your agency name. Then we get started with your checklist preparation, which would be looks like this. We get to you within 2 to 3 business days because we will be going through the latest regulations to make sure you get the up-to-date compliances. And then within 21 business days, we complete everything for you. And so you can submit the package after the 22nd day. And within around 2 to 3 months, including the 21 days, hopefully you should be able to get the license with our consultation support. All right, so going back to the presentation, the final parts of the presentation, the next steps I'll let you know that you should think about the branding, marketing, and building your referrals and the building the local partnerships, the hospital, social networking, and getting into the groups. And even though for this industry, the social media works, I would say 80%, but still 20% you have to do a little bit of work on this traditional marketing methods on getting your clients and the local referral market and everything as well. But 80% of everything comes from online with your website, and you have to be SEO friendly website set up so you get the calls to your phone, your business phone number, and you get traffic to your website. They book send you an email, the call to action. They can book a calendar event with you or a Zoom call. So that's how everything you should set up from your business side. And if this is something that you're looking for, you also offer all these services, the marketing, the website services, and the branding services for logo, business cards, and brochures, everything we provide for new home care providers like you. So these are website packages starting just for $299, and we provide the highest performing and modern websites for our customers for the price that you pay. So these are some examples of how the website looks. And it's fully customized, all copyrighted information. And this client is a veteran, and she wanted everything to be fully veteran focused, the content we write, the images we place. So it has to be fully customized. So based on your specific requirements, we can handle all this because we have an in-house IT team who handles all these projects for you. All righty, okay, I think we are good. We can move to the next slides. Yeah, this is a nursing care. All right, guys, let's go back to our presentation. We have, all right, so this is something you don't have to worry about our services, the quality of service that we provide. You can go through Trustpilot and see and check all our reviews, how our customers are satisfied and how they like our services. So you can go and check. All right. All right, so we have some questions and answers for common questions. We are trying to address that here. So what's the difference between the home health and the home care? As I mentioned, home health, that's for the medical care, but the home care or the home services, that's pretty much for non-medical. And how do I open a branch office or second location? So to open a branch office for home service agency, you must notify the Illinois Department of Public Health, submit a branch office application, and ensure the new location meet all the licensing and regulatory requirements. So that's doable. So it's a matter of notifying the state about your or the new office. You can use a home office. You don't have no problem if you don't have an office space. Don't hire or rent. I mean, don't rent a place at this stage of application, because there are a few months you don't need to pay for rental unnecessarily. You can still use your home office at the state of Illinois and use your home office to secure your application and get your approvals later when you really need office space, when you expand or when the state comes for inspection maybe, then you can consider getting to actual physical location. That's also an office space, because for home services you don't need group homes or anything else. So if you're from a different state and out of the state, you can always operate from a foreign LLC with the Illinois Secretary of State before applying. But my personal recommendation for anyone from the out of the state, it's easy for you to get through a new LLC within the state of Illinois and start your business. Going through a foreign LLC, still you need to have a physical location within the state of Illinois. So that doesn't make much sense unless you want to have a principal office on your own state and come back to here, the state of Illinois for a secondary business start. Do I need experience for healthcare? For non-medical, no, you don't, and you don't require RNs. You are not required to be a registered nurse for a non-medical home care agency in Illinois, but for skilled nursing or skilled home health, yes, you do require a registered nurse. You don't need to hire any staff in. Only two things that you need to consider are the principal and the secretary. So they are the two requirements that you need to worry about. So you don't need RN, as I explained to you. And okay, so inspection surveys, that happens, as I mentioned, 240 days you get a provisional license after your documents are approved, and then they would come for an inspection survey to provide you with the complete license. Okay, this is mentioned here. So this is how the license survey happens within 6 months of the provisional licensure. All right. And how much fund you should have in the bank statement? Let's say around 20 to 50K should be ideal, but there is no specific amount the state mentions, so they're trying to validate the proof of funds. They're not going to do that, but it's best to have something with you when you're trying to do this startup. But these amounts are generally mentioned, but this is not regulatory specified amount, but this is generally what you can have in order to get things started. Of course, you need the background check. You can't skip background check, and you have to go through the healthcare worker registry for all new employees before they can start work. And this is what I showed to you under the background check and the worker registry. So this is where you have to register every one of your employees. Can operate multiple counties, yes, and in the application, as I showed to you in the beginning, you are supposed to mention all the counties that you would wish to provide, and those counties that you can provide, and there are a lot of options for you to fill out or multiple counties that you can operate your business. Is there a provisional license before? Okay, I think we discussed about this. 240-day provisional license and on-site inspections conducted within 30 days of the provisional. Now, I think not 30 days. So this is, I think, around 6 months time. So I think we need to update this. The same question as reflected here. So how long will this take to announce an inspection after the initial application? So they would let you know within 30 days of the provisional license period. So this is for the on-site inspection. They will let you know for an announced inspection after your provisional license is issued. All right, guys. So here we are for the final Q&A session. You can shoot me if you have any questions.
So, good morning. So, right now, I already have my SILA license and my Pravilla license, my provisional license for the SILA. I've received that. I've just secured a home for the Scylla location. We're doing the contracts this week. Next week we're doing the contracts. We've agreed upon the price and everything, and then they'll be out for the inspection, and then I'll go forth with that. But I reached out to you all for my senior home. So for the senior home, I'm wondering, can I, it's a residential home, but within it, can I also do an application for the non-medical, this one? So
Uh,
I
mhm.
so I'm working right now with you all for my senior home with memory care and without memory care. But I'm interested with adding with that piece a non-medical
Yeah.
agent.
Yeah,
That
Latrice,
would be a
that sounds
third.
good. Yeah,
So that would be a third application, right?
yeah, yeah, that's correct. So we have to handle that as a separate application. As I showed in the application, we have to fill out those application and we can try to work with you in order to get you a separate license. So I don't say it's as an addition because this is going to be an additional license to your agency name. So we can
Yeah.
definitely work with you. Yeah, no problem at all. Yeah,
Okay. So that'll be a that'll be a third project that we do.
yeah, yeah.
Okay. So I'll
Awesome.
look forward to that because I don't think I had even considered that
Yeah.
until this presentation. And so who can I speak with to follow up about my senior care application after this presentation?
All right, Latrice, I'll be your contact point because as I handled your SELA and we're almost done and you received the license again, my congratulations to you. So it's a great thing. It's a great achievement because of your consistency, the dedication, regardless we as consultants help. So it's your determination which really worked. And it's a lot of work, as you know, SELA
A
is
lot
never
of work.
simple. It's a lot of work for SELA. Unlike any other state, this achievement that you have received, the SILA provisional license, is never easy task. Because
Yeah.
any other state, because we are doing 50 states, right? We are doing 50 states, different programs, group homes, residential treatment facilities, assisted living facilities, but SILA approvals, community integrated living arrangement in Illinois is never an easy task. So congratulations again. Of course, I would like to be your consultant to work with you as well on the home services. So let's have a separate chat, Latrice, to get things going.
Okay. Can we set that appointment at
Yep,
the
of
end of
course.
okay.
Yeah, I'll try to send you my I'll try to drop you an email soon after the session, and then I'll drop you an email and let's get connected.
Thank you.
Awesome. All righty, okay. So do we have any questions or anything that you want to clarify? Ziva, do you have any questions, anything that you wish to ask? Yeah. I know it's a lot to process, and this video we are trying to upload on YouTube as well, so on our channel, so you can go back and try to understand things if you want to watch this again. So yeah. All right. Okay. So if you don't have any further questions, guys, let's wrap this up for today's session. And I would like to say thank you, every one of you, for joining this session and making this more engaging and interactive. So let's stay in touch and wish you good luck on your journey. So if you have anything and to share with us, if you have any questions, please reach out to us at hello@carepolicy.us and we'll be available to support you throughout the journey. And also I have actually a request for those who joined today. If you think this session helped you, in some way to learn something that you spend this around 1.5 hours. If something helped you on learning something, I would really appreciate if you can leave us a feedback review on Trustpilot about how you enjoyed this session. That means a lot for us. And also, my team will be sending you a link for my LinkedIn account, and I would like to stay connected with every one of you personally. So if you have any question, please shoot me a message. So I'll try to help you the best that I can. All right. All right, guys. Let's wrap this up for today. I think we have perfect timing. So thank you very much again for joining, and let's get connected and let's stay in touch and have a great and wonderful day. Thank you, everyone. Bye bye. All right. Okay, I just send the link on the Trustpilot as well. So please take a moment, a minute or two. Please leave us a review if you enjoy this session. Thank you very much again.